So someone wanted to know about paroxysmal illusory tilt, and basically there are two types of this phenomenon. One is when you have a line like this and you see the tilt and it's there all the time. That's torsion, but there are also transient versions of this where the muscle is firing. So sometimes patients with superior oblique myokymia have this rotational sensation where they see tilt, but that's not an illusory tilt, that's a real tilt. So we want to make a distinction first between illusory and real. So in true torsion of the eye, where the eye is torted, excyclotorted or encyclotorted, that's a real torsion. What the question was illusory tilt. And that's the room tilt illusion, where the room looks tilted to you, and it's transient or paroxysmal. So this illusory phenomenon is usually some problem with either the vestibular system, the ocular system, or your brain's interpretation of it in the cortex. And so it can be a perception problem, or it could be a real perception, but it's a transient phenomenon because there's some sort of vestibular mismatch that is occurring. And so that means it can be either peripheral, that's from your ear, and that means things like endolymphatic sac lesions or semicircular canal dehiscence can cause paroxysmal input from your vestibular system that will give your brain and your brain stem a faulty signal that your head is tilted, and your brain will see that as your world is tilted. Then you got the central vestibular form, and that is in the medulla, probably the same input from vestibular system. So in patients who have the Wallenberg, which is the lateral medullary syndrome from pica infarction, you might have a transient tilt of your environment, or you might even say everything's upside down 180 degrees. So there's some sort of mismatch between the peripheral, the central, and the perception centers for your environment. And that produces a paroxysmal illusory tilt. So in your brain, the supratentorial lesions are going to be like seizure, migraine, stroke. These are in the perception of where the lesion is in space, and that's usually in the where pathway. That's in the dorsal stream, which is in the parietal lobe. Interpretation of where things are in space. And the peripheral lesions are going to be an ENT, and the central one is the lateral medullary infarct, the pica. It doesn't tell you what it is. It just tells you that there's a problem in the connection system between peripheral, central, vestibular, and your cortex, and can result in a very strange complaint, a paroxysmal, intermittent, illusory tilt. It can be 90 degrees, it can be 180 degrees, it can be completely upside down. And you should be working that up with an MRI.